The Brain Injury Guide and Resources is a tool for professionals, community members, and family to understand traumatic brain injury, as well as how to promote better living for those who live with a TBI. In this interview, we will talk with Dr. Eric Hart, rehabilitation neuropsychologist in the MU School of Health Professions, Department of Health Psychology, to learn about cognitive and psychological consequences of a traumatic brain injury. And Eric, thanks very much for joining us. We appreciate it.
Thank you. Glad to be here.
Eric, first of all, what are some cognitive difficulties associated with a TBI?
Well, there really are a multitude of different cognitive changes that can occur following a traumatic brain injury. And a lot of times they correlate with the areas of the brain that are most vulnerable to injury. And often we see the temporal regions of the brain and the frontal regions of the brain being most vulnerable for a number of reasons. And those correlate pretty nicely with some of the cognitive changes that are often found. And what we typically see are changes in mental processing speed. So it may take a little bit longer to come up with an answer to a question or follow through with tasks of daily living. A lot of times there's difficulties with sustaining attention or divided attention, paying attention to two things at once, or even filtering out excessive noises, which we refer to as selective attention. One of the most common consequences of traumatic brain injury from a neuropsychological perspective or a cognitive perspective is changes in memory. And it's important to distinguish about what type of memory we're talking about. A lot of times when I interview patients and we talk about consequences of traumatic brain injury, especially as I'm asking them about their memory, the most common response is, my memory's fine, I remember things from 20 years ago, I think that I'm probably doing okay. And that's really not the type of memory that we're concerned about. Certainly that would be a concern if there was diffuse impairment or forgetting who someone is or forgetting some of those historical information. But really what we're finding is the most common types of memory changes are short-term memory changes. So it's learning and retaining new information that comes into one's life. Which an area of functioning that can be very, very limiting, and we see this as being a common impairment following traumatic brain injury, is called executive functioning. And that can really comprise a lot of different types of functioning. This is essentially problem solving, judgment, learning from experience, reasoning, and things of that nature. We tend to see those correlate more so with impairment to the frontal regions of the brain, which again are very, very common following a traumatic brain injury.
Mm-hmm. And so how do these affect people's daily lives and their ability to return to work?
Well, in a number of different ways. Specifically the frontal regions of the brain being vulnerable and relating to some of those executive difficulties that we were talking about. As I mentioned, there's an element of self-control or monitoring and things like that that can be affected following a brain injury. And if someone has difficulty controlling their behaviors and that develops into outward aggression, irritability, or agitation, things of that nature, that can certainly affect someone's ability to maintain steady employment. Also, if someone is having difficulty completing tasks in a timely manner, remembering what they were doing, things of that nature can certainly be of great concern to employers and can often lead to high unemployment rates.
So what are the treatment options that are available?
Well, there's a number of different pharmacological and non-pharmacological types of interventions. We're still kind of in early stages of understanding best treatment options. I can talk from a psychological perspective. We often will look at compensatory strategies, so ways of modifying someone's environment to optimize their overall functioning. So a lot of times in my outpatient clinic I will work with patients to develop memory notebooks or to learn about risk factors or vulnerabilities to their cognition becoming worse, and then working very closely with our physicians who will be prescribing some of the neuropharmacological interventions to help cognition.
How about on the psychological side, Eric? What are some common psychological issues related to a TBI?
Well, first of all, it's important to note that psychological consequences of traumatic brain injury are really one of the leading sources of disability, primary sources of disability for survivors of traumatic brain injury. And what we're finding is that many psychological conditions occur at a higher rate among a traumatic brain injury population. Probably the most common psychological consequence of a traumatic brain injury is major depressive disorder. And in the quote-unquote normal or the general population, we typically see this to occur somewhere in the area of about 15 to 25%. Within a population of survivors of traumatic brain injury, we see it much higher, somewhere in the area of about 44%. So it's significantly higher, and there's a lot of research that suggests that the consequences of traumatic brain injury, both psychological, the adjustment factors associated with it, adjusting to limitations, and of course the organic changes in the brain can really put someone at higher risk for developing a multitude of different psychological conditions. Also, to a lesser extent, we will see a higher rate of bipolar disorder, and then many of the anxiety-based conditions, most notably panic disorders, obsessive-compulsive behaviors, and things like that. And we'll also sometimes see personality changes, and that's an area that's a little bit more controversial in the field, but it's not uncommon to see intensified personality presentation or even a dampening of emotional expression following a brain injury that can appear as though someone's personality has significantly changed from where it was before the injury.
Mm-hmm. So obviously these psychological issues can have pretty profound impact on people's lives.
Can have very profound. Again, we're seeing them occur more frequently within a brain injury population. We're actually seeing them also lasting longer within a brain injury population too.
Mm-hmm. And again, what are some treatment options that might be available in this area?
Well, again, there are a number of interventions, and essentially what we're finding in the literature is the ways to manage depression and anxiety within a brain injury population are very, very similar to the ways that we would manage depression and anxiety in the quote-unquote general population. Now, certainly there's some modifications that need to be considered. Pharmacological interventions, psychopharmacy, things of that nature are really quite important to address some of the chemical changes in the brain following a brain injury, and also some of the non-pharmacological ways. In my practice, I use cognitive and behavioral therapy. We look at thoughts associated with emotions and behaviors, and then more specifically from the behavioral end, we look to employ different strategies such as relaxation training and things of that nature to help optimize someone's functioning. Now again, we have to take into consideration some of the consequences of brain injury and modify our approaches. So by that, I will sometimes want to have shorter sessions, frequent feedback to make sure that the patient is comprehending what we're talking about, getting some of the main points, and then carry over from one session to the next. There's a lot of review of previous points from previous sessions to ensure retention, to accommodate for some of the memory issues. I certainly also want to add, as a treatment provider, I would be remiss in not talking about how brain injury also affects other people involved as well outside of the sufferer. Often is the case that we will incorporate family members into session. Certainly the consequences of traumatic brain injury can affect multiple systems such as relationships with spouses and other family members. I've found that incorporating family members can be quite effective and in many ways needed in the treatment of psychological issues following traumatic brain injury. And also, even encouraging folks to participate in supportive group therapy can be quite powerful as well, to experience sort of the normalizing effect, learning and realizing that they're not alone, that many folks also experience some of the things that they experience as well, and to also provide an avenue for social interaction as well. So those multiple other types of modalities can be quite effective for managing psychological conditions following brain injury as well.
All right, Eric, thanks so much for being with us. We appreciate it. And we thank you for watching this interview on the cognitive and psychological consequences of a TBI, a service of the Brain Injury Guide and Resources.